No, then we move to the next presenter. Okay. Our next presenter is Daniel. He's an PhD student at Masaryk University, and he's also a CEO of Kvak, a company that develops decision support systems for medical imaging. His research focuses on clinical application of machine learning solutions, design of implementation that deals with respect to medical workflow and regulatory strategies of AI system growing and the recommendation. So today, he will present paper titled Investigation as a Tool to Combat Racial Bias in Medical AI.
Thank you for the interaction, dear guests. It's an honor to be here today with you. I'd like to present you shortly a latest research white paper that we did with the title Synthetic Data as a Tool to Combat Racial Bias in Medical AI, utilizing generative models for optimizing skin cancer classifier performance. First of all, I'd like to declare the conflict of interest. This project was funded by Kvak Incorporated. Let's jump directly to the topic. Even though it's not the most prevalent, melanoma is considered to be the most aggressive form of skin cancer. Due to the similar shape of benign and malignant lesions, doctors spend considerably more time when diagnosing these findings. Malignant melanoma mainly affects the skin, but it can also affect eyes, ears, or even mouth or genital tract. Melanoma develops not only on sun-exposed skins, where UVA radiation is the main factor, but it can also develop in body parts that are relatively protected from radiation. The pathophysiology of melanoma development is yet not clearly understood. At present, the evaluation of the malignancy of the actual lesion is carried out mainly by invasive histological examination of the suspicious lesions. Despite the fact that people with Fitzpatrick skin types 4 to 6, which correspond to brown, dark brown, or black skin, are less likely to develop melanoma, they face a higher risk of mortality because of delayed detection and treatment. Very often, skin cancer in these patients is diagnosed at more advanced stages, making the treatment very difficult. Although the incidence of melanoma in Fitzpatrick skin type 0 to 3 population has increased by almost 20% in the last 20 years alone, a review published by the American Academy of Dermatology showed that the 5-year survival rate in Fitzpatrick skin type 0 to 3 population is 92%, while in Fitzpatrick skin type 4 to 6 population is only 70%, which is, well, significantly lower. The development of an accurate classifier aimed to reduce and monitor the negative effects of skin cancer and improve patient survival rates. Currently, however, Fitzpatrick skin types 4 to 6 represents a small percentage of dermatology images available as shown in table 1. This is actually a table from white paper on Nature by Google Health and their application Dermacyst. And as we can see, the Black or African American population is represented in the validation data sets around 6%. While in less regulated fields, we can encounter the use of synthetic data at basically all levels of research and development. In medical applications, they usually find their use mainly in the context of internal validation, data-driven applications. A study by Lee et al., which addressed the possibility of using synthetic data in clinical research and development, dates back to 2016, which was only 2 years after the original study that introduced generative adversarial networks in Goodfellow et al. In their study, Lee et al. Focused on the problem of limited availability of data sets and validating synthetically generated data using a pre-trained convolutional neural network-based multi-class classifier. The outcome images actually look very impressive, and even the team of experts that they used for the internal validation had a problem of detecting which images were real and which ones were fake. But the main limitation of GANs is that it can only produce data for a known domain. Although GANs can achieve realistic results when applied in denoising, chest X-ray generation, CT or MRI, for example, MRI of knee, which Novartis is actively working on, the use of random variable noise does not replace the closed-world assumption of training data sets. Besides, of course, there are domain transfer approaches for applying few-shot GAN models right now, for example, style transfer and so on, but these are not that widely adopted and are out of our scope of our particular research. So as a primary objective for our study, we decided to address the question of avoiding the data imbalance problem in skin cancer detection application, as secondary objectives to analyze the potential use of synthetically generated images of melanoma, especially for internal validation of these computer-aided detection systems, especially to analyze whether these synthetically generated melanoma images show the typical signs according to the ABCD rule, which is still very often used. For our methodology, we utilized the zero-shot text-to-image autoregressive models to generate the synthetic images of patients with Fitzpatrick skin types 4 to 6. For the selected experiment, we generated random 10 images, and these images were assessed by an expert dermatologist to determine whether they show the characteristics typical for diagnosis of the melanoma. As you can see here, these are the images that we were able to generate using these zero-shot text-to-image generated models. And of course, the evaluation of the skin lesion from a single image at a given quality is very complicated, because in clinical practice, for example, it is common to investigate the lesion during the personal examination using dermatoscopes. That basically allows us to have a better observation of edges, internal structures, changes in colors, and so on. And of course, dermatologists are able to touch the lesion, feel it, and so on. So regarding the validation, one of the most common methods used to identify melanoma is the ABCD and now E rule, which was introduced in 1985. The acronym stands for asymmetry, borderline irregularity, changes in color, and diameter. The acronym was later expanded in 2004 to include the letter E, which stands for evolving. Each criterion has certain characteristics that are monitored to distinguish between benign and malignant lesions. For our experiment, for each of the 10 generated melanoma images for patients with Fitzpatrick skin type 4 to 6, the possible type of melanoma and the characteristic indicative of it, with, of course, the exception of rule D, diameter, which was difficult to determine from the single image, was assessed by experienced radiologists with more than 10 years of practice. This table shows a list of possible differential diagnoses that may be benign as well as malignant. As part of the assessment, the examiner was only provided with the visual data shown in the previous images. For example, what we can see here is that the melanoma was assessed, or the synthetic images of melanoma were assessed by the expert dermatologist, usually as a superficial spreading malignant melanoma, or in a few examples, a nodular melanoma with satellite metastasis. And as you can see, regarding the A, B, and C rule, we're able to capture the individual characteristics that are typical for diagnosis of melanoma. Our experiment was subsequently validated by a CAP system using the ResNet 50 multi-class classification model, trained on the pre-selected Hampton 1000 dataset, which is a large collection of multi-source dermatoscopic images of common pigmented skin lesions. More than 50% of these lesions are conferred through histopathology, and the ground truth for the rest of them was determined either by follow-up examination or by expert consensus. Despite the limited knowledge of the target domain, the use model classified 7 synthetic images of Fitzpatrick skin type 4 to 6 patients as melanoma and 2 images as high-risk melanocytic nevus, shown in the table 4. In only one case, the model predicted the skin lesion as benign keratosis with high confidence probability. The heat map localization shown in the figure below suggests that the classifier might face issues with more findings on the individual image, or when the spatial distribution of the melanoma is irregular. The prediction results, together with high confidence, may suggest that a synthetically generated data possesses some of the typical characteristics typical for diagnosis of melanoma. As a conclusion, in our study, we explored the use of zero-shot text-to-image models to produce synthetic data for more accurate and fair diagnosis of melanoma in patients with Fitzpatrick skin type 4 to 6. Although the automatic detection and evaluation of skin findings is the subject of active research, the limited availability of data sets containing images of patients with Fitzpatrick skin type 4 to 6 for training clinically robust or validating clinically robust machine learning-driven models has not received much of an attention. Synthetic data may represent somehow reliable solution for at least internal validation of the existing data sets to improve the performance of other AI tools aimed at improving early diagnosis of skin cancer, especially in underrepresented populations. This approach could be applied, for example, to the Fitzpatrick skin type 4 to 6 patients, where data collection is more difficult right now due to more limited cases. That will be all from my side. Thank you for your attention.
Thank you very much for the presentation. So does anyone have any questions?